All right, hey guys, I'm Mrs. Iverson. I'm gonna review the neurological assessment with you. This is Mrs. McFeeters. She's kind enough to be my patient and help you guys learn this assessment for your validations. So with the neurological assessment, we are gonna start by assessing the patient's level of consciousness. All this means is the patient awake and alert? Are they comatose? Are they sleeping? Are they drowsy? What is their level of consciousness? So Mrs. McFeeters here is very awake, very alert. She knows what's going on. She's laughing. Orientation, I'm going to ask a couple quick orientation questions. So can you tell me your name?
Tanya McFeeters.
Can you tell me where you are?
I'm at Hack.
And what year is it?
2025.
Okay, so the patient is oriented to person, place, and time, which is great. We could always add in, the last one is what, can you tell me what you're doing here? What's the reason for your visit? And then you can say that the patient is oriented to the reason why they're here. And then we look at memory. So we want to look at 3 different types of memory. So we're looking at the immediate memory, we're looking at more recent memory, and we're looking at long-term memory. So if I want to know about immediate memory, I'm going to tell her 3 words, and then I'm going to come back to it here in a moment. So I'm going to have you memorize cat, dog, and fish. Okay. Then I'm going to ask her what she had for breakfast. That's more of a recent memory.
Breakfast.
A bagel, perfect. And then what were those 3 words that I asked you?
Cat, dog, fish.
Perfect. So her immediate memory is intact. And then what college did you go to?
Bloomsburg.
Okay, so she went to Bloomsburg for college, so there is her long-term memory. Her memory is intact. Then I'm looking at her speech and her language. I've already been assessing that as she has spoken her words to me, but we want you to really focus on all your patient's answers, but also focusing on the clarity and the fluency of their speech. So is she speaking clearly? Is she slurring her speech? The sky is blue in Cincinnati is something really good you can use to test this function here. I have you say the sky is blue in Cincinnati.
The sky is blue in Cincinnati.
Perfect. So that quote will really bring out any slurring in the voice. So I don't hear any slurring, so she has clear speech and her language fluency is great. And then we're going to Perla, so I would have my pen light, looking at her pupils, equal and reactive to light and accommodating. So I'm gonna shine my light in the one eye, I'm gonna shine my light in the other eye, and then I'm gonna have her look at my finger, and I'm gonna move it really close. And then I can say that she is 100% great in Perla. Her pupils are equal, round, and reactive to light and accommodating. Next is our 12 cranial nerves. So cranial nerve number 1 is the olfactory nerve. Olfactory is based on the sense of smell. In your validation, we may have several different scents for you to use. Right now, I have an alcohol swab, which is very nice and fragrant. So I'm gonna have her close her eyes, and I'm going to have her smell what I have in front of me, and she's gonna tell me what she smells. That is an alcohol swab. Perfect. So her cranial nerve 1 is intact. Cranial nerve 2 is oculomotor. So I'm looking at the, cranial nerve 2 is optic. Cranial nerve 3 is oculomotor. Cranial nerve 4 is trochlear. Cranial nerve 6 is abducens. They all have to do with eye movement. So I'm going to go through and look at all the things. So cranial nerve 2, optic, visual acuity. I'd be pulling out my Snellen chart. In your validation, we will give you a Snellen chart result and expect you to be able to tell us what that means. So if the patient is 20/40, at 20 feet, your patient can see what a person with perfect vision can see at 20 feet. At 40 feet away, I'm sorry. So 20/40, at 20 feet, your patient can see what a patient with perfect vision can see at 40 feet. And that would apply to any number like that. So there is our Snellen chart for cranial nerve 2. Cranial nerve 3, 4, and 6 is all about eye movement. So when we do eye movement, we're doing a star shape. So it's kind of like a 6-point star. I'm gonna have my patient look at my pen light, and it just be an object, be a pen, whatever you have. And you're just gonna move it in a star, or more like an asterisk shape, because you're testing their ability to move only their eyes and not anything else. And that would show that their eye movement is intact. There is no bouncing, no nystagmus, things like an eye not moving along with your pen would also be an unexpected finding. Cranial nerve 5 is the trigeminal nerve. Trigeminal nerve has a lot to do with facial sensation. So I'm going to stroke different parts of the face, and she's gonna have to tell me if she feels that or not. So I'm gonna have her close her eyes, and then I need her to tell me what area of her face I'm touching.
Left forehead. Right forehead. Cheekbone on the left. And cheekbone on the right. And the chin. And right on the chin.
I used my fingers, very light touch for that. You could use a cotton swab or cotton ball as well to detect the trigeminal nerve. I also want her to clench her teeth for me. I'm just palpating at that TMJ to test for cranial nerve 5, the trigeminal nerve. Cranial nerve 5 is intact. Moving on to cranial nerve 7, because we already did 6 with eye movement. Cranial nerve 7 is the facial nerve. So I just have a list of activities for her to complete in order to be to have an intact cranial nerve 7. I'm gonna have her raise her eyebrows. I'm gonna have her squeeze her eyelids shut. Don't let me open them, okay? So I'm trying to pry her eyes open and I can't. So she has strong cranial nerve 7. I'm gonna have her wrinkle her forehead. I'm gonna have her frown. I find it hard to frown. Smile, show your teeth, and then like pucker your, like kind of like a puffer fish, like puff your cheeks out. Perfect. And then purse your lips. And then this would also be testing taste, but we're not having anybody eat anything for validations. Cranial nerve 8 is the auditory nerve. So we could do a whisper test. We could say,
hot dog. Dog, cat.
perfect. So whisper test, great. And that means cranial nerve 8 is intact. Cranial nerve 9 is the glossopharyngeal nerve. This is the ability to swallow. You can tell your patient to swallow, and you can palpate the swallowing motion here on the neck. You could also have the patient say ah as you look in the mouth, and you can assess for that glossopharyngeal with the uvula, the movement of the uvula. Cranial nerve 10, I already did 10, was the vagus nerve. I'm sorry, I think I said glossopharyngeal. That was cranial nerve 10. The vagus nerve was the ability to swallow and saying ah with the uvula movement. Cranial nerve 11 is the spinal accessory nerve. So looking at that, we're looking at the sternocleidomastoid, and we're looking at the trapezius muscles. So we're looking at the bulk of the muscles. We're looking at the tone of the muscles. So having them move their shoulders up and then drop them down. So bulking of the muscle, we would be concerned if there's like hypertrophy or the muscles are just too tight all the time, not able to relax, or atrophy, meaning like loss of the strength. Tone would be that they have active tone. They can tighten them up. They can move them around. Strength would be that she was able to shrug her shoulders against resistance. And then range of motion, I'd have her just roll her neck around, that she has good range of motion of her neck. And that is my cranial nerve 11 spinal accessory. Last but not least, the cranial nerve 12 is the hypoglossal nerve. I'm gonna have her stick out her tongue. I'm looking to make sure that there is symmetry. The tongue is not wavering to the left side or the right side. And then I'm going what we would call midline, coming out centrally. And then also speech, she has talked to me, but I can have her say, the dog ran.
The dog ran.
So she's articulated, she has dynamic in her voice, and she's not monotone, and she's able to repeat what I'm saying. Then I'm gonna go into the motor sensory part of the neurological assessment. So I'm gonna have her stand up. I'm gonna have her walk heel to toe, like tandem walking. And then she's gonna turn around and go walk on your heels. Perfect. And then I'm gonna have you stand here with your eyes closed, arms up in front of you. And I'm gonna protect her because I don't want her to fall, but this is the Romberg. So Romberg is all about positional sense. If someone closes their eyes and they fall over, they've lost that ability to maintain their positioning. So you can open your eyes, you can rest your arms down, and then I'm gonna have you sit down and do some upper body strength. So you can grasp my fingers and squeeze really hard. Perfect. And then you're gonna do lower body strength. So I'm gonna have you dorsiflex and plantar flex. So toes up to your nose against resistance, and then like you're pressing on pedals of a car would be plantar flexion. And great, that's 5 out of 5 strength. And then we're gonna do a pronator drift. So I'm gonna have you place your arms in front with your hands in a supinated position, and then you're gonna close your eyes, and there's no drifting of her arms. Hands does not drift down on either side, so we don't have any pronator drift. You can open your eyes again. Now fine motor and coordination, we're gonna do fingertip to nose. So all you're doing is you have your arms out to the side, you're gonna bring your finger to your nose, finger to your nose. Perfect, you're not kind of going all over the place, you're able to precisely go to your nose, so that's good. Then we're gonna do heel to shin. So you're gonna take your heel and you're gonna rub it up and down your shin. Good, and do it on both sides. Great. And then we're gonna do light touch. So you're gonna have you close your eyes, and I'm just gonna lightly touch either in upper extremity or a lower extremity, and just tell me what you can feel.
Left arm, right knee, back, right arm, left shin.
Perfect. And then point localization is going to be with eyes closed. Patient points to a place touched. So I'm going to, instead of her verbalizing where she's touching, she's actually going to localize that point. So I'm gonna have her close her eyes again, and I'm gonna touch a spot, and she has to touch exactly where I touch. Okay, I'm gonna do something on the right side. Okay, awesome. So point localization is great and intact. And then we're gonna get to the reflexes. So deep tendon reflexes, we're gonna talk about the tricep reflex. So looking at the tricep here, so I've noticed the twitch in the tricep, so that's intact. All right, so we're gonna cover reflexes, the deep tendon reflexes. So first up is the tricep. So you're gonna take your patient's arm, you want it to be really relaxed. So you're gonna grab a hold of their arm and kind of let it go loosey-goosey. So then you're gonna take, whether it's your reflex hammer, you can use your stethoscope, you're going to tap, and you should see this arm just slightly move. That's the tricep reflex. Now looking at a bicep reflex, bicep reflexes are gonna be on the medial aspect of the antecubital. So I usually like to kind of hold my my patient's elbow, and I like to bump against my own finger with the reflex hammer or my stethoscope. So I go like this, and I should see a twinge of the lower aspect of the upper extremity. Then I'm gonna go to a brachioradialis. So looking at the brachioradialis, that's at the wrist. So if I bump this, then the lower aspect of the thumbs and fingers should just jerk around because of the brachioradialis reflex. The patellar is right below the kneecap. So you're gonna just kind of tap this. Always have to kind of make sure that they're relaxed, because if the patient is not relaxed, the reflex doesn't elicit well. So we're gonna do that, and you can kind of see the jerking motion that elicited. The last one is the Achilles. So looking at the Achilles is just taking your reflex hammer or your stethoscope to the back of the back of the foot, and it will make the foot plantar flex. And those are the deep tendon reflexes. All right, and then last but not least, we're talking through two of the superficial reflexes. So the abdominal reflex and the Babinski reflex. You are not going to be expected to perform these in validation, but you just need to understand them and know how to elicit the reflex. So the abdominal reflex is you're stroking away from the umbilicus. So if my umbilicus is here, you're just stroking away from the umbilicus, and you should see a twitch in the umbilicus or your belly button. And then the other one is the Babinski reflex. We usually do this in kids. We see this in kids. You shouldn't see it in an adult unless it's abnormal. So the Babinski reflex is when you take your foot, volunteer myself, take your foot, okay, and then you're stroking upward. Now you're not going to see my foot do anything because it's abnormal to have the Babinski reflex in an adult. But if you would see the Babinski reflex, the toes fan out as opposed to just being in a normal position. So you would see the toes fan out, which I'm making it do for the effect of talking you through this reflex.